Hi, everybody. Welcome to another episode of the ASAP Pathway Podcast. I'm your host today, Dr. Stacey Ochoa, and I'm here with my sister from Australia, Dr. Shereen Lim. She is amazing, and we just hopped on with each other a few minutes ago, and there's so much I want to say to her. And I thought, let's just start the podcast because I just want to ask you organically live. She's just an amazing person. For those of you who aren't familiar with Dr. Lim, let me just do a quick introduction. And there's so much more I could say, but I'm going to try to summarize. Dr. Lim is a dentist based in Perth, Western Australia, with a special interest in children's airway health. She's been actively involved in the team management of snoring and sleep apnea since 2011. She's passionate about promoting healthy breathing and airway development from infancy. Dr. Lim authored the book Breathe, Sleep, Thrive. Discover how airway health can unlock your child's greater health, learning, and potential. Dr. Lim facilitates knowledge exchange through her Facebook group, Airway Health for Kids, organization of integrative airway conferences, and speaking presentations. In her private practice, she focuses on tongue-tie management, early orthodontics, and myofunctional therapy to optimize health and wellness. Without further ado, welcome, Shereen. So glad to have you today.
Glad to be here. Very excited. Thank you, Stacey.
And she is in Australia, so it's like 4:45 at night, Thursday night here, and she's getting ready to start work Friday morning and taking time before work just to have a conversation. And I know that's a lot, so I really appreciate it. So I was looking on your website, and again, we have very similar journeys. And here we are on the other side of the world, and we have similar experiences. And I see you got to have interaction with Dr. Christian Guilleminault. I mean, what an honor to be part of the journey with him before he passed. I mean, what an amazing man. And he's done so much for sleep medicine and raising awareness about the collaboration between medicine and dentistry. He was one of the biggest fans of working with dentists on your team and felt it was super important. What started your journey? You've been doing this a while. What happened? We get through dental school. We're not taught this in dental school, right? Like, what happened? What took you on your journey? Where did you start?
Yeah, it was my husband snoring. My husband snoring was driving me pretty crazy. So I got out of bed one night and researched dental appliances to help reduce snoring and sleep apnea. And I decided, you know what, this is a big problem. I'm going to try and help other spouses in the same problem. So I enrolled in a postgrad diploma in this area and just became one of Australia's first dentists to qualify in it and became involved in the management of adult snoring and obstructive sleep apnea and realized this is not just a noise. It can actually impact people's health significantly. And this device that we're offering patients, it's really a Band-Aid solution for poor craniofacial development. So why don't we develop the jaws properly in the first place? And so during that course, I came across Dr. Christian Guilleminault's work, palate expansion in young children. He was exploring that for a treatment option in obstructive sleep apnea. So I first met him in 2014 and I told him, like, your work has inspired me to learn early orthodontics to be able to offer this in our practice. And he said to me, if you're starting palate expansion, you're too late. So at that time, I had no idea what he was meaning, but that really sort of sparked my curiosity and it really got me learning more about myofunctional therapy and tongue ties and how the greatest or peak jaw development occurs in the earliest years of life. So
that's amazing.
Function, we've got to really address the oral dysfunction as early as possible.
I think that's so important, what you just said, because this is where the ASAP pathway movement has been. We're just trying to address the demographic of children. Of course, we teach, skeletal expansion all the way up to the non-growing, adolescent, young adult. But the impact, you just said, like he said, if you're discussing palatal expansion, it's already too late. It's like the car accident has already happened. And now you're trying to clean up the car accident. But what if you can get to those kiddos when they're babies and the nose first gets obstructed, maybe in infancy, maybe it was a cold, maybe the mom or dad didn't know how to do nasal clearing and they just had a bad virus and it just converted them to mouth breathing and they never got back on track. Just catching these things along the way. It's a demographic of children, Shereen, that aren't being identified. And we as, family dentists, we see kids all the way from birth. I mean, we see the pregnant mom and then she brings in baby in the pumpkin seat, right? She wants to show off baby when she comes in for her checkup. And you can see that if that baby's mouth is open, we got to have a conversation. It can start that young. So
absolutely. And, the more and more I'm interested in this, I have stopped seeing as many adults. I no longer do the mandibular advancement devices. I have too many patients, but it's quite unsatisfying to think. And I'll still see adults who come in for tongue tie release or they want some opinion about myofunctional therapy. And it's just very despairing because oftentimes, they have significant anxiety, depression, headaches, and just really poor quality of life. And to see that facial pattern that's occurred in them, to see that craniofacial problem, just thinking, gosh, we could have sorted this out as they were growing. People are missing those clues. So I think it's really important that we work together to really promote more awareness and how we can intervene early.
I think too, maybe for some people listening, they don't understand what a mandibular advancement device is. So I have a journey similar. I started with my dad having sleep apnea, couldn't tolerate a CPAP. So CPAP is continuous positive air pressure. Basically, it's taking room air and it's blowing the airway open. Again, it's not curing apnea, right? But we're just managing an airway at night. But a lot of times these people, they breathe poorly all day. It's not just nighttime. They breathe poorly during the day. It's just heightened because our sympathetic tone drops at night and it's more exaggerated in the evening. But mandibular advancement devices for adult, okay, this is the non-growing adult. Basically, a dentist can make an appliance that looks like two retainers that basically hold the mandible, either stabilize it or bring it more forward to keep the airway patent. Again, like you said, it's a Band-Aid. We're not curing anything. I mean, and I always tell people, I'm not curing. I don't like to say I cure anything. I am walking alongside people. People's lives are dynamic. Even a child that I can help them with upper airway resistance, or even let's say we do overcome that CPAP and they don't need it right now. I can never say this child would never need a CPAP in the future, or this child will never have issues with apnea again. They may gain weight. They may have other metabolic syndromes. But what we're saying is we can change the trajectory, insert ourselves in a child's life right now, and at least improve their life right now and walk alongside them. That's our goal, is to remove obstacles in their life right now and then walk with them on the journey. So you went from all adults, dental sleep medicine to, all right, now I'm going to start looking into kiddos, early interceptive orthodontics. Did you do the orthodontic training first, then go into tongue release, tethered release after that? What was the order of that?
Yeah, I started with the orthodontic training because when we refer children to an orthodontist for early intervention, quite often they're put on this regular recall where they don't have any treatment started and we want to wait till they're age 12. And I didn't actually want that. And I kind of knew I've got young children. I want to avoid this. So yes, I got in through the orthodontic route. And then attending more and more conferences. I started with Dr. Derek Mahoney from Australia. I felt very aligned with his approach and his knowledge of airway and sleep. So that's why I chose to start with him. And he introduced us to lots of other different speakers and, he's very on board with myofunctional therapy. But Dr. Herman Ramirez, that was someone he promotes as the best person to learn from for primary dentition malocclusion. And his approach is really working on the oral dysfunction. So I got more and more into that from there. And tongue tie release came a little bit after. But I knew from that moment that I was going to learn how to do it, because at that same conference I first met Dr. Gimeno. That was when Dr. Herman Ramirez said in the first year of life is the peak mandibular development. And the number one most modifiable influence on that is going to be breastfeeding. And I knew that tongue ties could become a barrier to breastfeeding. So that's how I became interested
Well, there
in
was,
that area.
and this is so true. I mean, the anatomy does matter. A lot of times the anatomy is, form follows function, right? So the muscles are going to determine what happens with that bone. The muscles are going to determine it. So if a child stops breathing through their nose, and then that tongue is not in the position it should be, which is the roof of the mouth, putting that pressure, how the cheeks, how the lips maintain pressure. If that's not happening, we're going to have a more narrow maxilla, base of the nose. And then everything just domino effects after that. So then you started getting more into the function. And this is so true. Like, even in my personal journey, I was looking at interceptive orthodontics expansion even earlier, 5, 6, 7. It was earlier than most orthodontists even in the United States do anything. But they're so moldable at that young age. And the amount of change that you can get with just a little bit of interception is just amazing. So changing bad habits, digit sucking, pacifiers, proper breathing, proper swallow. So the importance of function kind of came a little bit later for you, it seems like. So it was more like, let's mechanically correct the damage. Then it's like, well, wait a minute. How did the damage get there in the first place? It was a function issue. So then you started getting more into the function, it sounds like.
Yeah. And another thing to add is, when I first done Dr. Derek Mahoney's program, I knew that he was really well known for non-extraction orthodontics. And I found it a problem that people were getting referred for extraction of teeth before they had braces, because we weren't actually addressing the underlying jaw problem. And I knew actually when people need teeth extractions, their jaw's underdeveloped. And if we try to remove teeth and close those spaces, we're actually going to constrict their tongue space further. So I was feeling fairly passionate at that time about doing non-extraction orthodontics to do fixed appliances or full braces. And so I did learn that through Derek, and I did do full fixed braces in the practice as well. But then you start to realize, gosh, it's so unstable. And if we can actually address those dysfunctions early on, we're going to get more orthodontic stability. So I think, that was another thing that made me think, I've got to start younger. It's too unreliable if we do braces. We're just like so stressed and worried about how much things are going to relapse.
Yes, so
We
true.
need to start earlier.
So true. So what is, obviously you're seeing babies days after birth, or, a day or two after birth. So your youngest patient is a newborn. So what is your practice like? Like, how are you structured? Do you see newborns throughout the week? Or do you have certain days where you're seeing those babies? Because I know it can be kind of loud when that's happening.
Yeah, definitely. The days that I come to work, people say it's a little bit of a zoo, but I have a fantastic practice manager, and she sets up the books super well, because we just have so much demand for everything, and we have to make sure that we can get people through. So we have certain pre-box where we might see babies and do baby reviews. Then we have new consults where we might see children or adults that have tongue tie concerns or mouth breathing concerns, snoring, teeth grinding, all those type of concerns. And then we have treatment blocks for all our orthodontic appointments, so that we can get people moving as quickly as possible. So we have quite a few different things going on. But yeah, it's really amazing what she does, because
thank God for those people in our practice, right?
Yeah.
I mean, they make it. We can't look, we can show up at our offices and do what only we can do, but there is no way we can do this without our team. So it's like props to our team that see the mission with us and live the mission with us. And they want to make sure, I mean, they are part of this journey because it couldn't happen. It just couldn't happen
Mhm.
if you didn't have all these awesome people on your
Mhm.
team doing this. So you have, I mean, you're seeing even adults still. So do you have a myofunctional therapist like in your practice? Like, how are you doing that? Do you have a set aside area for myofunctional therapy? Are you referring out for that? Or did you include that in your practice too, in your transition?
Yeah, we have a couple of people here offering that, and an ex-team member that moved away, she's been offering some online therapy so we can still work closely together.
Oh,
But
that's
yes,
nice.
everything in our practice is busy. We always need to grow, and we'll have to explore other options. Yeah.
So if you had to say, let's just say it's a dentist listening right now, an orthodontist, a pediatric dentist, a dentist. What is the most rewarding thing about, because, let's get real. We're all listening to how much education went into this, and it's a journey. And I always tell people, and I had Dr. Julie Davis on one time. She's an ASAP member, and she said, when you start this, like, it's like a rabbit hole, you learn one thing and then it goes into another. I mean, you don't have to do all of it, but you feel like you want to at least understand most of it to network properly. But she said it's like drinking from a fire hose. It's like there's so much information. If you had to tell another dentist why it's worth it for you, what are you seeing in your practice? Why is this worth it for you to intervene? Because we both know there's some naysayers out there, right? That there's no real purpose. There's no advantage to intervening early. That kids will just kind of grow out of some of these issues if you just let it be for a while.
Yeah, I think when children are not thriving, it creates great concern for parents. And the problem is with a lot of these issues, they're very often overlooked, whether it be a tongue tie, or child's breathing disorder. People don't have enough information, and problems get dismissed. And what this means is, for instance, if we go back to a tongue tie, like parent might say, oh, I had it checked by the pediatrician and they drew a picture for me to show me that this wasn't actually very severe and I don't need to intervene. Parent never thought about it again, but they've experienced so much problems. That child is, for instance, very unsettled. They can't enjoy their baby. It's just a nightmare for them because, this baby's not feeding well, very unsettled. They're swallowing so much air and just not being able to enjoy it. How much stress does that cause a new parent? And nobody's really listening to them. Everyone's
It's
telling
true.
them it's okay. So in my practice, a lot of the people that I see are people that have had very significant problems and worries for their child. And it's really quite common for me to have people crying in the practice because no one's really listening to them. And so when you can help them to let them know that they're not crazy and to actually do something to turn their child's life around, and just be able to enjoy their children, to be able to give the attention and focus to the other children in the family, yeah, that's super rewarding to give them a solution that they've just struggled so hard to find. So yeah, that's what I think is so important. And that's why I'm so passionate about raising more awareness of these issues.
Well, I think what you said too, I feel the same way. My team they'll vouch for this as well. When we have a pediatric airway consultation, pediatric sleep and airway in my practice, they know it's going to most likely be a very emotionally charged appointment because the parents are coming in they want to be heard. So really like the first 20 to 30 minutes sometimes is the parent just wanting to be heard with the symptoms, how long this has been going on, how they've bounced from this doctor to this doctor to this doctor with no help. And they're looking for an answer. And, I always tell people, look, I'm an airway dentist. I'm comprehensive. I look at the airway. I understand the role of sleep in our wellness and health. I am a piece of the puzzle. I am not everything, but I will work my hardest to collaborate with other providers that we might need on our team. But dentistry definitely has a place. We are, we have a seat at the table for sure. But like you said, it's like these parents just want to be heard, you know, and they just are so relieved that there could be some connection with what's going on with their kiddo. I had a mom yesterday who just came for a new patient appointment with both of her little ones. And she said, you know, her biggest, we always say, you know, what's your chief concern? What can we address today? What's on your radar? And she said, oh, my child's grinding. They're constantly grinding their teeth, and you know, it's driving me crazy. I just want to make sure their teeth are okay. So in her mind, they're grinding their teeth, and she's worried about the health of their teeth, which is understandable because they're wearing down. And oh my goodness, we took a CBCT. I mean, those adenoids were literally completely obstructed, touching the cone. And I was like, oh my gosh, you know, this, and his lips are chapped. He's not breathing through his nose. He had crowded baby teeth, you know, no spacing. And so we just had and his sinuses were completely blocked too. And I said, we're just going to have a conversation about how your son is breathing and how he's had to reroute where he breathes. Her face was like, wait a minute, I'm coming to the dentist. Why are we talking about ENTs and viral load and all this and allergic rhinitis? And so it's so impactful, the role we have, just to quarterback and even collaborate and get somebody to, you know, an ENT that's never been told. We just see things that nobody else is seeing, you know, so it's very rewarding for those dentists out there. And like, it does feel like a fire hose is turned on with the information you're hearing, but it's like just even understanding and learning how to screen these kids, right? And just screen and identify, it makes a big difference. You don't have to, I mean, you're doing amazing things. Not everybody has to do everything that you're doing, but if they just take a step and just do one thing first, that's what you and I did. We didn't know how to do any of this, you know, we just took a step and learned one thing, you know, start with one thing, start understanding the bigger picture. How is it in Australia as far as how receptive is your community to this? Other, you know, dental professionals, the community in general. I always feel like Australia is a little more, you guys are a little ahead of us.
Yeah, it's funny. People always think that, but I do not agree.
Really? I always feel like, oh, if you're Australian, they understand, the population in Australia understands function better than the American population, but you don't agree with that. That's my assumption too.
Yeah. I mean, you guys have so many courses available. So if you're in the US, you can do a course. There's so much available and so many people on board. So it's a little bit more hard work here. But I do see that there is growing interest. And one of the great things that I see is I'm getting a lot more dentists bringing in their children. And so I always think this is a good sign that we have open-minded people who want to learn more. And so because there's a void of education in this area, I'm involved with organising these events and conferences. And I've got one coming up in August in Melbourne. But yes, no, I don't think so. You know, we sort of had a discussion before about their orthodontic editorial or commentary in ADOJO, and that's someone that's in my neck of the woods. So yeah, it's hard because people are getting taught one thing and they hear this in lectures. So it is very frustrating. But yeah, I just work harder and get more people on board as we can.
That's so funny you're bringing up that paper, because I think I was talking to Mike DeLuke. Oh, I emailed him that opinion article, and then I emailed another orthodontist in town, because if you look, he mentions St. Louis, you know, and I'm like, oh, he better not be in St. Louis. But he used to be in St. Louis. I didn't know he was in your neck of the woods. And I thought, how can this mentality, how can somebody even speak like that if you want to discuss things like airway and be involved in airway and sleep, you should have gone to med school. Like, I mean, we're all doctors. We all are. Like, if you just want to make people pretty and you don't want to address health and wellness and ask the needed questions, maybe you shouldn't be a doctor. If you just want to make teeth pretty and you don't want to deal with health, that's fine. Because there's plenty of patients that just want their teeth pretty and they don't care about the health. Do that. But don't tell other doctors that, you know, are asking the needed questions. I mean, as dentists, I mean, I take blood pressure on every patient, right? Before we see them. We had a patient we had to take to urgent care yesterday. You know, his blood pressure was off the charts, stroke risk. And he was like, "You mean I'm not getting my teeth cleaned today?" I'm like, "No, you could actually have a stroke any minute in the chair. So we're getting you." I mean, if anything, I'm so glad you stepped in my office today because we're identifying something that you need help with. He goes, "Well, it's funny. My insurance lapsed. So I haven't been taking my blood pressure medication." I said, "See, everything happens for a reason." So to say that dentists, just because we're asking these questions and we see the connection and we collaborate with our medical colleagues, it's not being a medical doctor wannabe. It's part of oral medicine. It's part of being a good doctor to ask these questions, to screen every patient. So I was just kind of shocked that that mentality actually exists out there. So it was very shocking.
Yeah. So when you ask about how advanced we are, I think this is where we're at. One of the last events was pediatric sleep bruxism, and the speaker, the expert, basically said, "I don't really want to be here. There's nothing really to discuss on this topic." But you know why I think this is problematic. Like you talked before about that patient that came to you for teeth grinding and how happy they were to have these answers. But often when we get a child in for the teeth grinding, we'll actually see that they have multiple problems. They've been in speech therapy for a few years. They're on ADHD medications, or they have a problem with bedwetting. And all these problems, if we can start to recognize the underlying airway problem and address that, we'll find that many aspects of child development will be better, and people won't have to see multiple professionals and have multiple problems. They're getting addressed separately. So I think that things do need to change.
Yes.
And you guys are doing a really much better job over in the US, you know, with people like Steve Carterson, who's actually helped with the ADA policy. And, you know, really myself having had an opportunity to be a keynote speaker at one of those events, it's not necessarily something that would happen here in Australia. So yeah, I think that as much frustration as you guys feel, you guys have some really great people that are working collectively to drive change.
And let's just shout out to Steve Carstensen for a second. Dr. Steve Carstensen, who has been so instrumental with the American Dental Association. What Dr. Lim's referring to is the policies in 2000, and I believe it was 2017. Wasn't it 2017 when those? So they came out, the American Dental Association, that it's recommended that as a guideline that, you know, every dentist should be asking the pertinent questions in their health history, because there is such a correlation between, you know, craniofacial changes and sleep-related breathing disorders. We know there is an anatomical component, and we see that we see the phenotypes, and we should be able to ask those questions and refer and get them tested. But then they also said not only for adults, also with children, asking pertinent questions that could help us collaborate better and get those kiddos help with sleep and breathing issues. And it went on to further say, if you feel comfortable and have the training, to also intercept when needed, if a craniofacial interception. I like what Steve Carstensen and Kevin Boyd call it, the craniofacial respiratory complex, you know, that it's all connected, you know, and I think we just did such a disservice. We used to, in medicine and dentistry were very connected, you know, way back in the day. And then we just started compartmentalizing the body and creating specialties, which is great because there's so much we're learning about each part of the body. But then the mouth got completely compartmentalized out of medicine altogether. And I was talking to Dr. Susan Maples the other day, and she said, it would be wonderful if medical, residents and would actually part of their residencies and internships would be to collaborate with, dentists and understand oral health. Because there's a lot of things. They kind of look in there and go, I guess everything's okay. It would be great if we could just start having conversations about what does a vaulted palate look like, and just it's the entryway of the alimentary canal. It's an important part of the body, and it tells a story. I just, you mentioned that you're having a conference coming up. What's your conference? You're hosting this, correct?
Yeah, correct. It's called Inspiration by Integration 2024, a practical guide to children's airway health, and it's 6 speakers. So I'm going to speak for the first time in one of my own events, and I've got 6 speakers from different disciplines. So we've got Dr. JJ ENT, Renata, myofunctional therapist, Dr. Stanley Liu, who is a maxillofacial surgeon, and a couple of local speakers, Jim Papadopoulos, sleep physician, and Noor Taraf, he's an orthodontist. So really just a couple of talks each, and allowing plenty of time for integrative discussions so that we can throw out and exchange different ideas as well. Yeah, so
that is awesome. Is that a full day event, or is it a day and a half?
It'll be a 2-day event.
A 2-day event. And
so
when is
the
this?
plan is really day 1, really building that awareness and what to look for. And day 2 would be more about, how do we integrate the treatment? Because not one specialty has the answer for all.
Amen to that. And that is where I think too, some of the negativity or the static that's kind of against the early intervention making a difference. They're throwing out a lot of statistics about apnea and obstructive sleep apnea, which is really very end stage disease.
Absolutely.
It's very end stage. And when you look at the extrapolations of, they estimate about 5% of the pediatric population could suffer from obstructive sleep apnea syndrome. But it's bigger than even obstructive sleep apnea. It's upper airway resistance or sleep-related breathing disorders. It's mouth breathing. And there's connections with just mouth breathing and snoring alone in children having neurocognitive and behavioral changes and issues as young as 6 months old. Looking at these children over years and years and years. They studied 11,000 children. This is the Karen Bonnick study. It's extremely eye-opening. Wow. None of these children had a PSG or an AHI assigned to them. They had a symptom of snoring or mouth breathing. So we can intervene with that. We can get in there and help, change that trajectory for them. I'm so excited about your symposium. That's awesome. And I just think, the more of us in this world having these conversations, and more parents are then being advocates for their health and really asking for and not settling, and just asking this, my child deserves to be comprehensively evaluated, and just don't give up. There's hope. There are practitioners out there that will listen. But I love what you said, let me go back, that some of the negativity and the static about this interceptive, there have been some maybe company-based institutions out there that have almost put, this device will cure a child's apnea, or this device will cure an adult's apnea. And I think that kind of, they hear those whispers and then they broad, stroke and say, all of us think that way, or all dentists doing early interceptive ortho thinks everyone needs to be expanded or everyone needs a tongue tie release. And that's just not the case. There's going to be, I'm sure in any profession, there's going to be people that maybe aren't looking at the child as a whole and really figuring out what that specific child needs. And maybe there are people out there like, everybody needs an expander. Everybody needs a tongue tie release. I mean, what? And that's like the New York Times. Did you, I guess I'm assuming you saw the New York Times article that came out that had everybody on fire just about, the big money-making business of tie releases. I mean, it's like, it's unfortunate that because there are plenty of children that need these releases. And I hope that article didn't have a parent that was contemplating it, maybe not do it, that actually needed it for their child. So I heard they were supposed to have another piece come out. I don't know if you heard that too, that they were going to release another piece that actually showed the benefits of it. I don't know. Someone told me that. And I'm like, no one ever reads the second article that comes out saying, let's talk about when it is necessary and all the benefits. It's just the big one up front, and no one ever goes back and reads the follow-up articles about, well, let's talk about where it actually does help. But I do love what you're doing. And I love that. You're just amazing. You're really pumping out some amazing information and educating the public. And we at ASAP, we're just huge fans of you and what you're doing to really be a rock star in your community and helping so many people. And now, like you said, you're getting more dentists coming to you with their own kids. I find that that's where a lot of change is happening in this movement, Shereen, is you're seeing more dentists with their kids say, wait a minute, okay, I'm seeing stuff in my own house. We're being affected by, maybe oppositional disorders, ADD, ADHD, bedwetting, poor grades, failure to thrive, what have you, fill in the blank. And they're saying, wait a minute, what if my profession could actually be a piece of this puzzle? Like you said,
definitely.
I think
people that are so used to referring to orthodontist, all their patients to orthodontist and being told to wait, but then they sort of want something better for their own child. And then seeing it's possible to get that. I hope it inspires more people to get involved and be able to fill that void.
I hope so too, sister. I really do. I think I just have personally seen in my office, I've had ENTs reach out or, other pediatricians that have reached out and said, why are you, and I'm huge on continuity of care, including the entire team. So when I see a kiddo that mom is stressed, dad is stressed, they're like, something's going on, I don't just fire them off to an ENT and not include all the healthcare providers that have been on this journey with this child. My goal is I always send a letter to every healthcare provider they have seen, just to let them know the findings, why I'm doing the referral, including them in on this, because a rising tide raises all ships. Like, maybe they just need to have a conversation. Maybe they just need to see an article or some literature. So I always encourage other dentists or dental specialists getting involved in this for the first time. Please include, when you're making these referrals, include the other healthcare providers, because at the end of the day, most healthcare providers, we go into this because we care. We care about people. We love our patients. We want to do what's best for them. And it's not that these other healthcare providers don't want to help that child. It's just, it's not something that's taught in medical or dental school. So it's just about raising awareness, even among the healthcare providers. Would you agree? How do you make that inclusive? So you're I mean, including more healthcare providers to hopefully educate them. Are you doing something similar, like sending out
Yeah, I
letters
think
or?
that's ideal. If we have time, we should be including everyone. To be honest, it's not something that I have that sort of time to be able to follow up and do that. However, if there is a new provider that's referring, or if there is a new health professional, I can just offer them a copy of my book, because it has all the information, it has all the
Oh, that
references.
is beautiful.
And,
Your book says it all.
and
Your book is everything.
yeah. And so that's been really helpful. And then for others to be able to do the same, a lot of people buy bulk orders direct through me to be able to issue in their community. So I think it's really helpful that it's great to hear that it's been helpful for others as well.
Very much so. I think we were at, I want to say it was at the American Dental Association, the 2023 ADA Pediatric Airway Symposium. I spoke there, Michelle Weddle of ASAP Pathway, she spoke there. And I remember, did you send a bunch of books to the ADA?
Yeah, I asked Light Scalpel if they would be prepared to sponsor it. And so, yeah, I'm super grateful to Light Scalpel because they have actually purchased and gifted so many copies of this book at various conferences, whether it be nursing, pediatric dentist, and that. So yes, it was thank you to Light Scalpel.
Well, we were at the table. So we're at the speaker's table. And
Yeah.
Steve Carsonson was looking at his phone or something, and he got real excited and he like stood up and announced it. And I was like, oh my gosh, how awesome is that? It's like, everybody get your book, from Dr. Lim. And I was like, oh, I'm so proud of you. I just was so proud of you. And then he looked at me and he's like, if you haven't talked to her yet, you need to talk to her. She is somebody you have to know. And when Steve Carsonson tells me I have to know somebody, I listen, because he is very, Steve is a master at connection. He'll say, I don't personally do, pediatric airway therapy in my practice. I don't personally do it. He refers as he sees it. He works really close to Rebecca Bachau. So he's really fortunate to have her nearby. I'm like, wow, what a great person to have like up the street from you. So he in his community, he's active that way. But I always tell him what he has done, the connections he's made, the how active he is. And he has so much respect from the American Dental Association, the American Academy of Dental Sleep Medicine. They respect Steve. I mean, he's about helping people. And I appreciate him even, bringing you on my radar last year, but I had crossed paths with you just over the years, just because we have similar journeys. And I just, we're your biggest fans. I'm fangirling over here. I'm just a big fan of yours and what you're doing. And
I really appreciate what you guys are doing as well, because, I do get a lot of requests. When are you going to put on a course? How can we learn more? But yeah, it's fairly easy to teach, I guess, but it's the ongoing mentorship. You would feel so responsible to be able to hold people's hands once you've taught them. And there's not a lot of programs that offer that. And so it's not something that I feel that I'm ready to commit big time to. So I think for you guys to do it and to have the three of you that can work collectively to be able to help support people, that's really filling a void as well.
well, I appreciate that so much. And that is part of why we developed ASAP Pathway was what did we wish we had that we didn't have when we started this? Because you can take a course and then you go home and, you might have a rep that you can reach out to, but you don't have doctors that you can reach out to. And at the end of the day, we are the doctors and we're held to the standard of care and we want to take good care of our patients. So you don't want to have necessarily just, as knowledgeable as the lab technicians that have guided me, at the end of the day, they're not another doctor. So we wanted a doctor-led program that mentored and walked alongside. But let's just get real. If I was by myself, Shereen, I could not do it. So it just isn't going to happen. So the fact that there's three of us and
absolutely
we each have our strength. I'm like, I do not do what Tracy does. And I don't do what Michelle does. We all have our strength. And I'm so appreciative that I have the three of us, the two of them, because it just wouldn't happen. And it's been it's been a great journey. It's a lot of work, but at the end of the day, we're glad we have each other. We're so appreciative. And we're glad that you are, I mean, really, you're on our team too. We're all wanting to accomplish the same thing in our different parts of the world. And I just appreciate you so much. I know you have to get to your huddle before you start seeing your patients and doing miracles of the day. I had a few questions, if you wouldn't mind. I love to end just to get to know you just a little bit more. And I love to take people back to their childhood. And I try to think of questions to ask to spark like a walk down memory lane, if you will. But sometimes I keep asking the same questions because I'm just really interested what people did when they were little. So and I know you're from Australia. Did you grow up in Australia?
Yes, pretty much.
Okay,
ever since I was 1 month old.
Okay, so you have Australian culture and I have American culture. So I'm not sure what your answers are going to be. So what was your favorite TV show when you were a kid? What did you love to watch when you were little?
I love Sesame Street.
Oh,
I think even when I was 9, I was thinking, is there something wrong with me watching Sesame Street at age 9? I remember thinking,
tell you, if Sesame Street came on right now while I was folding laundry, I think I would just keep it on. I love Sesame Street. I love Sesame Street. Me too. Well, I guess that was I didn't know you guys saw that in Australia too. So, what is your favorite color?
Pink.
Pink.
Oh, or black. I like wearing black.
Pink or black, or both together. And what was your favorite snack as a kid? Like something you're like, oh, that was my favorite when I was little.
Oh my gosh. My favorite snack.
Like a favorite treat. It could be really, really bad and unhealthy for you, but what was your favorite treat?
Oh, I really cannot think. What did I have?
Don't tell me you ate broccoli and cauliflower all the time when you were a kid. Did you have candy bars?
Yeah, I would say probably chocolate.
Chocolate?
Was
You
a good one. Yeah. I recall that doing the whole taking the chocolate sneakily.
Yeah, sneaking some chocolate when you were little.
Yeah.
So you're a milk chocolate, not a dark chocolate person?
Yes, at that time, probably milk chocolate, but I can take anything now.
I know. Now I'll take chocolate in any form possible. I've expanded my palette of chocolate the older I've gotten. And I'm like, I probably should learn to like dark chocolate, even though I prefer milk chocolate. So, well, I appreciate you, everything you're doing. Thanks for being with us today. I hope we
great to connect.
Get some parents that start doing deeper dives, and maybe we get some more practitioners open to changing how they see their little patients every day in their practice beyond the teeth. It would be wonderful. Well, thanks so much. Love to talk to you again soon. I'll see you later.
Perfect. Thank you.
Thanks.